Good afternoon and welcome to the Faculty Staff Town Hall sponsored by Penn State Today. Today, we will be discussing how Penn State continues to manage the impacts of the coronavirus pandemic, including the recent announcements on workforce changes, plans for summer, and work being done by the task groups to return students to campus and employees to work. As with our other recent town halls, we're continuing to use social distancing techniques. We've been soliciting questions for a few weeks now, and we will answer as many of your questions as we can today or after this session. Today, we have with us University President Dr. Eric Barron, Executive Vice President and Provost Nick Jones, Vice President for Student Affairs and Co-Chair of the Return to Campus and Community Task Force, Damon Sims, Vice President for Human Resources and Co-Chair of the Return to Work Task Force, Lorraine Goff, Associate Professor of Biology and Researcher with the Center for Infectious Disease Dynamics, and Penn State co-chair of the Public Health and Science Assessment Task Force, Matthew Ferrari. First, Dr. Barron, would you say a few words?
Well, thank you. And hello, everyone. I just want you to know that as we work through this crisis and we think about our planning, it is the safety and well-being of all of Penn State, our students, our faculty and staff. That's what the overriding concern is. And we know there's a lot you may be worried about. You may be worried about personal health issues or family health issues. You may have financial concerns, or you may be wondering about coming back to work if there happens to be the presence of the coronavirus. We're busily working on scenarios back to work, but we're doing it to make sure we do it as safely as possible. And that ranges from everywhere from making sure we have the guidance of experts, which you'll hear something about, to the opposite end of the spectrum, just ordering 500,000 masks that we can distribute to our community. And there's more to come on that score. We're also not making abrupt announcements. We're not sitting there saying, this is what we're going to do, or this is what we're not going to do. We're taking this one step at a time, and we're doing it as a community. And that way we can be thoughtful. We're also working really hard to be mindful of our role that this university plays in this community. We live here, we work here, we need it to be a vibrant community. We need it to have a high quality of life. So we also contemplate what every decision we make, what kind of impact we have on our community, on our friends and our neighbors. And you can see a lot of the things we do in terms of the mission of this university and serving the Commonwealth in the actions that we do. A couple of quick examples. Intercollegiate Athletics has a Happy Valley Adventure Bureau. And the whole idea there is to have Nittany Lion fans think about supporting the businesses in our community. Or you can turn to launch boxes that are focused on economic development, or extension, which is focused on the success of the agricultural community, both having gone virtual, both striving to help make those parts of our economy even stronger than they were before. We also have to make a lot of difficult choices. And one of those choices to make sure that we have a robust university are looking at measures of how it is that we can control costs during this crisis. We're looking for a lot of opportunities to save resources, to cut costs. Just a single example is in procurement. That we know that if we limit the use of purchasing cards and we move more into large-scale contracts for purchasing, we can save this university millions of dollars. And that translates directly into making sure people stay employed and making sure that we don't try to charge our students too much. That's our strategy, to support you, our employees, to support the surrounding communities. We don't have all the answers. We don't know how the health crisis will change. We're not sure what enrollment will be like. There is the possibility of federal and state support that is there. We have a lot of different issues, and the key here is a little bit more time. approaching mid-June, we feel like we're going to have a much better handle on a lot of these issues. But the key is we're taking the advice of a lot of different experts. We're being thoughtful, we're being careful, and that's our focus. Thank you.
Thank you, sir. And now Provost Jones would like to outline what the university has been doing to help slow the spread of the coronavirus.
Thanks, Ben, and welcome everybody. It's great to be with you virtually again. We know that this pandemic is a huge challenge for all of you, both personally and professionally. And I hope it does ease your mind somewhat to hear about the groups that President Barron just described and how they're tackling this challenge with our community's best interests in mind. Penn State, as you know, is a large and complex institution, and these groups are looking at all the ways this pandemic is impacting our university, its students, and its employees, and always making the difficult decisions with our community's health and well-being at the forefront. Last week, I think as most of you are aware, we concluded the spring semester with our virtual commencement, or I should say virtual commencements, because we had a number of follow-up ceremonies as well. I want to congratulate once more our class of 2020, and I also want to thank our faculty for making the very hard and fast transition to a remote learning environment in the space of a week. In the best of circumstances, it can be challenging to change how classes are taught, and it is nothing short of extraordinary to see our faculty and staff come together in this crisis and witness the innovation and creativity that is the hallmark of Penn State's faculty. We know what a challenge it has been to teach and conduct research remotely while balancing childcare and other personal matters, and our faculty did it with grace and excellence, and always with a focus on the best outcomes for our students. I also know we will want to be back on campus when we can do so safely. So our task groups are continuing to rise to the challenge of confronting the many, many issues that need to be addressed before we can do so. They are surveying faculty and staff on their opinions and considering employee needs in all the decisions that will need to be made. For instance, we're in the midst of rolling out a comprehensive return to research plan that will allow us to slowly restart in a safe and effective manner on-campus lab and research projects that simply cannot be done remotely. You will hear more about these plans in days to come and other critical priorities as we continue to work on these efforts. Today, you will hear from the leaders of 3 of these task groups, and I look forward to having them share their important work with you. Thank you.
Thank you, Provost Jones. And as you just mentioned, we are going to hear from those co-chairs about the steps that they're taking. Damon, we'll begin with you and the Return to Campus and Community Task Force.
Thanks, Ben. It's good to see you again. It's great to be with colleagues today talking to the university community. I think that the effort to unwind the university and move into a remote environment that Nick was just describing was a significant challenge, and it's really remarkable how well we came through that. But I think if anything, a greater challenge is thinking through everything that's going to be involved in returning us to in-person experiences. I think that's by far the greatest challenge we face. The Return to Campus and Community Task Group that I co-lead is charged with finding the best path for returning students to all locations in ways that minimize the risks, very real risks posed by the virus. We have 3 co-leads. I'm one, but I'm joined by 2 others, Jeff Adams, who is in the undergraduate education office. He's an associate vice president there. Kelly Austin, who also is an associate vice president in the Commonwealth Campus Vice President's office. So we're representative of the various interests in the university, but we're joined by about 30 other senior faculty and staff members who have various areas of responsibility. And so there's great variety in the voices that are involved in this conversation. importantly, as I think both Eric and Nick pointed out, everything we're doing is informed by public health and science. We have the very best experts, one of whom is joining us in this conversation today, who are giving us advice about everything that we're considering. We're also scouring the national landscape for an understanding of what other institutions are thinking about. And of course, all of us have connections across higher education in the country, and we're learning from our colleagues what their challenges are and how we might be able to meet these challenges together. The virus, of course, is going to have the final say perhaps on what's possible, but for weeks now, my colleagues in the Return to Campus and Community Task Group, which is really divided into 5 work groups, we have been focused on both classroom experiences and outside the classroom experiences, and trying to make sure that we can have those experiences in as safe a manner as possible. The 5 work groups are built around these themes: instruction, that is one that's led by Marie Harden, who is the Dean of the College of Communications. We have a public health operations group, which really takes the good work from the Public Health and Science Task Force and tries to think about how to operationalize those things in the context of the student experience especially, and that's chaired by Andrea Dowhauer, an Associate Vice President in Student Affairs. Social distancing, a theme we all know way too much about perhaps, but we need to learn even more about in this context, is led by Beth Seymour, who is the chair of the Faculty Senate and a faculty member at the Altoona campus. Compliance and enforcement, that's another theme that's going to be important. We're going to have to set out some new expectations for folks and expect that they will comply with those expectations. We may even have to enforce some of these expectations in various ways. Danny Shehay, who's an Assistant Vice President in Student Affairs, chairs that. And then we have a communications sub-work group that's led by Lawrence Lockman. Communicating these messages to students and others will be critically important. And we need to get after that probably well before we return people to campus so we can start to socialize some of these new ideas that we have. We're considering everything from the academic calendar to class schedules, classroom setups, blended learning possibilities where we combine the remote experience with in-person experiences and various safety protocols to try to minimize the risk to both students and faculty in the classroom. But I think from my perspective, the greater challenge is going to be found outside the classroom where we have less ability really to control things. But in residence halls, fraternities, off-campus housing and apartments and houses, dining facilities, buses, student organizations, activity centers, coffee shops, recreation centers, libraries, lounges, all these student interactions, both with administrative units and service entities on campus, but importantly, student interactions with other students, the kind of typical extracurricular and social lives that our students lead. That's going to lead to a lot of challenge in terms of minimizing the risks that the virus poses. So we're working closely with the Public Health and Science group on testing, contact tracing, quarantining and isolating, probably all topics that people are becoming familiar with, mask usage, temperature taking, various strategies for social distancing, and then of course the compliance and communications tools that are going to be required to make all these things work. But most of all, and more important than anything, this is a university-wide effort in which each member of our university community, students, faculty, and staff alike, must, when we have an opportunity to return to in-person experiences, must commit themselves to not only their own well-being, but the welfare of others too. I really think that only through determination and commitment of students, faculty, and staff alike will this undertaking succeed. But if any university in this country can pull it off, Penn State is the one. Thanks, Ben.
Absolutely, sir. Thank you very much. Now, Lorraine, can you give us an update on the Return to Work Task Force?
Yes, thank you, Ben. And it's great to be here with you all this afternoon. I want to start by just recognizing how difficult these times have been, It's been a challenge for every member of our community, both personally and professionally. And it has been great to sort of see this community come together and work on addressing this challenge as a community. I very much appreciate that. And I'll also share with you that the challenges will continue for a while. There's a lot to be done. And so we will continue to work together, university leadership and all of the managers will be working to try to address the challenges and the obstacles and the difficulties you might be facing to try to ensure as much as possible a safe and smooth transition back to the workplace. And I co-lead the Return to Work Task Force along with Abby Deal in Faculty Affairs. It is made up of academic and administrative leaders from across the university. It includes faculty and staff, and we are all working together to try to address those critical and challenging issues that need to be addressed in order to return back to the workplace and return in a way that is as safe as possible. So we have 4 different task groups, and they're all focused on several different things. One is focused on a transition back to work, which will be in a phased approach. The phased approach really is the way that we believe makes sense to bring the workforce back. We see it as being a fairly slow and methodical process to ensure that we give time to assess what's happening so we can make adjustments and frankly that we can pivot if we need to. We have transitioned out of the workforce in telecommuting, and so we have found that we actually can work fairly effectively telecommuting. And so that can be a very useful tool as we return to the workplace. As Damon mentioned, transitioning out of the workplace and the campus may actually be easier than coming back in. And so we want to make sure we do it in a thoughtful and careful way, and that we are flexible so we can adjust if we need to, depending on what's happening. This is an evolving situation. We learn new things each and every day. Sometimes by the hour, we learn something new. And so we are making the best decisions we can, knowing that we may have to adjust, and we've got to make sure we build the process in such a way that it is flexible as much as possible. In addition to thinking about how we phase the workforce in, we are also looking at facilities. You know, how do we need to adapt our facilities, our common spaces, cubicles, private offices. We're looking at protocols around guidelines, wearing face masks and proper sanitation and personal hand hygiene and those sorts of things. We want to make sure we provide guidance to units about how they adjust their workspace, thinking about adjusting work schedules to allow for social distancing consistently for some period of time. And we also want to make sure that employees feel supported. So we have a separate group focused just on that topic, making sure that our policies support the organization appropriately at this time, making sure that we have childcare that's going to be aligned with that as we transition back to the workplace, making sure that we consider accommodations. We know there are people who are going to need an accommodation for a variety of reasons. And so what do we have in place to ensure that we can help people think about how they transition to the workplace and do it in a way that is as comfortable as possible. It is clear, and it cannot be overstated, the need for careful and thoughtful transition planning. And so we're very focused on doing that. And the key for us will be to continue to monitor. We are monitoring what's happening in our local communities. We monitor what's happening nationally. We are gathering information from our peers and other organizations to see how they're thinking about returning their workforce. And we are going to continue to do that so that we can adjust if we need to as new information becomes available. But I also want to pause for a second and share my gratitude for this community. They started in the beginning. We know it's a difficult time, and we have seen that people have come together in a very helpful way. They're sharing their point of view, they're serving on committees and on task forces, and they are really helping us think through as much as possible this organization. And it is clear that people are working very hard. You know, working remotely also means working hard and often working long hours. So we really do appreciate that. And I have one request for you. So Nick mentioned that we are trying to gather information, and we are. Tomorrow, you should receive a link in your email box asking you and inviting you to participate in a survey. And that survey will allow us to get perspectives from our faculty and staff about the things they think we should have in place in order to return to the workplace. What those things that might make them feel more comfortable returning to the workplace. And so again, we're getting input from a variety of places, but we also want to hear from as many of you as possible. The survey shouldn't take more than 10 minutes. It's somewhere around 8 minutes or so. But I think your input would be really helpful and allow us to think about all perspectives as we consider the next set of decisions that need to be made for this organization. So thank you, and I look forward to answering your questions this afternoon.
Thank you, Lorraine. And we will remind you about that survey coming up in our forthcoming messages about this town hall. Now, Matt, can you give us an update on the Public Health and Science Assessment Task Force?
Sure, and thank you. So it's been quite a while since we last spoke, and everyone has mentioned we've learned quite a lot, both about our community, about our institution, and about the science and the evolving science of this particular pandemic and the public health science in controlling this. So I'm helping to lead a team along with Jennifer Santiago and Dennis Scanlon, as well as a variety of other staff and faculty members from across the university at all levels to help support the efforts of the return to work, return to research, and return to campus and communities task groups by bringing the evolving public health knowledge to bear on university planning. And to that end, we've really been focused on 3 key areas: prevention, detecting outbreaks if they occur, and mitigation in that event. And these are the 3 primary stages that have focused our attention. So prevention requires the basic 3 pillars: distancing, hygiene, and PPE, like masks. There are an increasing number of well-documented case studies of transmission outside the home that tells us about high-risk settings, such as high-density office seating, poor ventilation, and discussions and strenuous activities without masks that can lead to transmission in the community or in the office place. So we're looking to limit many of these kinds of activities, at least initially, and then we're suggesting perhaps additional vigilance at transition points in the university calendar, such as when students are returning, we might pivot back a little bit and then slowly relax again at these time points where we see risk ramping up. So hygiene is then also a way to protect yourself, and masks are a way to protect others if you're infected and you don't yet know it. So as we ramp up all of these interactions through research and work in the workplace, we're going to encourage everyone to do both, to wash your hands and wear a mask, so that we have this safety net that allows us to progress in these staged returns that have been described by others, and then we can do so safely. Now, if an outbreak were to occur on one of our campus, we'd want to detect it really quickly. And we're operating as though this is something that's likely to happen, so we want to be prepared for it. So this means we're going to be providing for testing. So now if someone has symptoms, testing allows us to confirm or exclude COVID really quickly, so we know how to handle them and whether they need to be isolated. But the odds are, from what we understand about this virus, is that the first case on campus might not even be symptomatic. So we're considering offering testing to employees and students who look and feel healthy. And the more of this that we do, the better the chance of catching an outbreak before it takes off. And thankfully, so for those of you that have been watching the news and have been learning about testing, or any of you that have experienced it yourself, the collection methods have gotten a lot easier. We can now rely only on saliva, and we don't have to use those long, unpleasant swabs that have been the standard for so long. And so we also know we're looking at the experience of other countries and other communities, and we've seen that isolation of infected individuals, tracing and testing their contacts, and quarantining their contacts can really keep transmission under control while returning to business. And there have been a number of examples in Australia, New Zealand, South Korea that have really seen this be effective and return to normal operations. And the truth is, we already have some of these procedures in place. We have contact tracing and quarantine procedures for employees already in place through occupational medicine. And UHS has already been working with the Department of Health to do contact tracing and isolation in the student population. What we're doing now is working hard to develop the procedures and put in place the infrastructure so that we can do this at scale, at the scale that we need to for an organization of this magnitude. And as we slowly phase in this return to campus, we'll be able to test and trial these procedures, and so that we can really be confident going fully ahead at full speed. Thank you.
Thank you, Matt, and thank you all for providing that information. It was very helpful and gave an update to this entire community on what the university has been doing. Now we are going to start with some of the questions that have been submitted from the audience. And again, we will get to as many of them as we can during and after the town hall. Dr. Barron, we're going to ask the first question to you, and it was one of the ones that we received the most out of all of the people submitting. And can you give us an update on what is happening in the fall?
So we are proceeding, and you just heard from 3 different task groups. We're proceeding with the notion that our objective is to open in the fall for residential education and to have the full Penn State that we love so much in operation. There's a lot to do between now and then, and the decision is not one that's firm. The idea is that we gather this information, we get an understanding of where we sit, what our capability is, how we can do it safely, and then we will come up to June 15th, a date that we've announced and discussed with the Board of Trustees as a look to see whether or not anything may stop us from doing that. And if there's serious concerns, then we may have to rethink the plan. But we're operating as if we will, but we'll have these checkpoints to make sure that we can do it safely.
Thank you, sir. And make sure you're following Penn State News for the latest updates in the virus info site, and we will make sure you are well informed of those decisions as they are happening. Dr. Barron, we're going to stay with you. And many people have asked, for those individuals who have been furloughed, does the university have a timeline on when they might be brought back?
So a timeline sort of suggests that you've got some particular a decision already made, but instead we have multiple factors that are there. One is we're watching carefully the guidance that we're getting on the federal side and the state side. And as you know, our governor has a red, yellow, green structure that guides what will work and what doesn't work. So you see already with us going to a yellow that a lot of different operations that are approved by the governor are beginning to come online. As we begin to bring more individuals back for research that must occur, then we need folks to be there to help us open the building. So you see that the governor has released the external crews to work on landscape and other areas, because under conditions of being safe or being out there by yourself outdoors, you are safe. And so we're systematically bringing back those employees as we're able to do so and as required in order to be able to do many of these functions. But this is a stepwise process. As I said from the beginning, we're one community, we're taking one step at a time. So there's no fixed timeline. There is, we will do this as we're able.
Thank you, sir. And as a follow-up to that question, have there been any talks of any further furloughs or even layoffs?
So again, we've tried to be systematic. We've watched some of our fellow universities or systems say, okay, we made the following decision, we're going to be remote. We made the following decision, we're going to be on campus as normal. There's too many variables here. We would rather be thoughtful and do the very best we can. So this is part of the reason why in the first 45 days, I said we would keep our employees whole. And then as this began to extend, we said, okay, we will take employees that cannot work. We'll keep them at a 50% level. We want to make sure that their health benefits are there. And we know from the stimulus that if you're making under a certain level that you will be made whole under those structure. Because this is important to make sure people can pay their rent or they can pay their mortgages or they can put food on the table. Our employees are incredibly important to this institution, and we know we will be back. And it'll be important to have our family there with us. But again, we looked at the circumstances of the pandemic, governor's orders, other different factors, what's open and what's not. And we said, okay, the next part of this, we can do that until we come into June, and then we're going to have to the end of the fiscal year, and then we're going to have to look at it again. So we will take that one step at a time, but no one is sitting there already saying, nope, we must do this, we must cut our workforce, but we are very sensitive to the fact that if you have facilities that are not open, it becomes more challenging. But we're not gonna jump the gun. We're gonna make sure we're thoughtful, make sure we're deliberate, do our best to keep our employees whole. That's what our objective is.
Thank you, sir. And speaking of keeping our employees whole, Lorraine, we have a question for you as a follow-up. And if you could talk about what Penn State is doing to support individuals who have been furloughed or are just going through a hard time right now.
Yes. In terms of the employees who are unable to work remotely effectively, probably the most important thing we've done is actually what Eric just described, which is try to maintain pay at some level. So we are continuing to pay them at 50%. But beyond that, we've provided resources to help them understand the impact on their health insurance. We want to make sure that remained intact. We provided information about how to apply for those unemployment compensation benefits. Detailed information about how to apply, as Eric also mentioned, many of those employees are actually eligible for unemployment. And the combination of the state unemployment plus the funds available through the federal stimulus process can keep many of our employees whole, depending on income level. We also have an employee assistance fund that is available to Penn State employees who are facing major financial challenges. That is also available, and information about that is on the HR website. And then, of course, we have the Employee Assistance Program that provides a variety of services and support, counseling, referrals for financial counseling, referrals for legal services, a benefit, again, paid for by the university and made available to our employees. And it really is available to members of our community, whether they're part of this group or not, because these are difficult times, and they can be a very good resource in terms of thinking through how to manage all that is happening, all this change that we are all facing.
Thank you. And again, all of those resources are on the Penn State HR website. Provost Jones, we have a question for you, and it's one that comes up from time to time, but many people are asking now about the voluntary retirement program that happened a few years ago, and if this might be a time to enact a similar program again.
Thanks, Ben. Actually, I'm glad that I was asked this question by somebody because it came up during my spring virtual campus visits, and it's an important one for us to address. By its very definition, a voluntary retirement program is not something that we can plan for in the sense of giving people a heads up that it is coming, because they only work when they happen and nobody was expecting it to happen. I don't want anybody to interpret that explanation as meaning that we're working on one or one is coming. I'm not making any statement along those lines at all. What I would say is, if you are eligible to retire and you are considering retiring, you should not be trying to plan that around the prospect of Penn State doing a voluntary retirement program. You should have a conversation with your financial advisor, and you should make that decision in a manner that is best for you and with the advice of that individual. So I want to be clear. This is a non-answer. I'm not saying we are or are not working on one, but that should not be a factor or a consideration in your decision about the timing of your retirement.
Thank you, sir. Lorraine, we have another question for you. And you started to talk about this in your opening statements about returning to work and maybe a phased approach. Can you talk about what those phased approach or a hybrid approach might be, and what timeline there would be for people to come back?
So absolutely, we're still working on the planning. We do not yet have a definitive timeline, there are several factors to consider with that, including what's happening at the national level and in the Commonwealth of Pennsylvania. So the timeline at the moment is not confirmed, but the phased approach really will be looking at beginning to move people back into the workplace in a way that allows for social distancing. There are some roles that lend themselves to working remotely more so than others. For those who need to be on campus and need to be in one of those work locations, they would likely be the highest priority to return, while others continue working remotely that can do that. And there are people who, for a variety of reasons, would be concerned about returning, often due to health reasons. We would certainly consider that in terms of the timing. So we are still working on the plans, but the key is to gradually bring the workforce back, some percentage, maybe 20% of the workforce, work with unit leaders because they're the best to know how many people need to return and do their work on site. And then have time to assess and see how things are going. And then if we need to adjust, we'll certainly adjust and then transition another group in. But the key for us is taking our time to do it well. We know we can work effectively remotely. And so that could be a very useful tool as we take our time to transition back into the workplace. And we will have more to come in terms of timeline, I suspect, in the next few weeks. We'll have more information and we'll be able to be more specific at that time.
Thank you. And just so I understand you perfectly, you said that you're going to be considering the factors of who needs to be on campus to do the jobs that are there, and also people who might have special health concerns?
That's exactly right. Yeah, those are some of the factors we would consider.
Thank you very much for that clarification. Matt Ferrari, we have a question for you now. And can you please describe some of the measures that the university is considering to promote health and safety for staff members and for faculty members when they do come back to work?
Yeah, and in some sense, I really want to harken back to what Lorraine has just described. That stage process itself is one of the most effective things I think we can do as an institution to protect everybody in the community. What we're trying to do is to avoid an outbreak, to detect it quickly if it happens, and to mitigate it if it does progress. And that phased approach allows us to put systems in place, test them out, and not go too fast, and not run past a point that we're uncertain we can contain at any one point. So all of these pieces are working really intimately together to this may seem like it's something about the workforce and returning to operations, but this whole plan is part and parcel of a larger effort to try and keep the entire community safe. And then within that, then we have two other major focuses, right? One is at the individual level and one is at the system level. So at the individual level, we're talking about the big three here: distancing, hygiene, and masks. Those are the best ways that individuals can keep themselves safe and keep others safe. And it's then incumbent upon the university to be flexible in allowing individuals to undertake those things. So working with unit leads to reduce worker density, stagger timing of workers in the office place, right? All of the many things that Lorraine has described thus far are very much about trying to facilitate distancing while balancing the operational needs of the institution. And then again, within that, providing for sanitizer for hand sanitizer for personal hygiene, masks, increased cleaning schedules within the workplace, right? These are then all allow us to have that hygiene and PPE backup, right? In the event that we can't always maintain the idealized distance that would protect us 100%, right? Because we really do need to get back to work. And then at the institutional level, then now this is where we're taking up systems of monitoring and testing. Again, so that we can identify outbreaks quickly, identify individuals with symptoms, rule out COVID for the very many people who are going to get sick but won't have this disease, right? We want to identify that, get them back into the workplace as they can, but then also quickly identify these outbreaks if they happen, and limit them before they spread too far and cause the larger scale kinds of disruptions that we're seeing now.
Thank you. You mentioned hand sanitizer, masks, things of that nature. Will the university be able to provide some of that equipment?
Absolutely, and in fact, I think even at the beginning of this, there was an announcement of 500,000 masks being purchased for the university community, if I'm getting that right. So hopefully someone will nod at me. Yep. So yeah, absolutely. I think I'm actually on campus for the first time in many weeks, and there's sanitizer all over the place. So clearly, the university is stepping up to put these things in place and provide both guidance and procedures for using these things. And that's really quite important, so that everybody not only has the things, but knows how to use them in the most effective way. And I think that's what's really important. It's not just about the things, right? It's about using them in an effective way, right? And I think if we look to the examples of things like hospitals that operate in a high-risk, infection-prone environment all the time, right? Doctors and nurses maintain their health. They keep their patients healthy, right? I think that's exemplary of the fact that we can do this if we maintain procedures and get everybody well enough educated to understand what to do with these things, and provide the sanitation and PPE elements that are necessary to do so.
Thank you. Lorraine, I saw you nodding along in there. Is there anything you'd like to add to that?
No, I would just like to confirm what Matt said, that absolutely that we will provide, we will make available masks. Again, 500,000 already been ordered, hand sanitizer, disinfectant, and any other PPE that's needed for someone to do their job safely. Those are high priorities to us, and something that is certainly front of mind.
Thank you, Lorraine. And we'll stay with you for just a moment. Are there any plans to have employees screened before returning to work? Maybe something like checking their temperature, as we've seen elsewhere?
So no final decisions have been made around screening yet, but there are active discussions about temperature taking, about testing, about contact tracing. So those conversations are happening right now, but no final decisions have been made at this point.
Understood. Thank you. Damon, we have a question for you. And as we proceed to bring back students on campus, if that does happen in the fall, how are you going to protect the communities surrounding the campus?
Well, of course, Ben, the virus doesn't know these boundaries between campus and community. So it really is a community-wide issue. We've had many conversations with various parties in our communities. I know that Matt and others have talked with members of the medical community here, and so it's viewed as a problem that cuts across the boundaries of university and community. And that's certainly true, in my world when I think about students returning to campuses. At University Park, of course, 2/3 of our students live off campus in the community, and that's where not only they live, but they shop, they socialize, and much of their lives occurs there. So we have to do all we can, I think, to see it from that perspective as an issue that is community-wide, and we have to partner with people in the community, share resources and insights with them. We have to think about messages that are shared. We can't be sending mixed messages. I think at University Park and in State College, we have very strong relationships, but I think we have relationships across Penn State and all of our communities where that kind of collaboration in trying to address this issue is not only necessary, but going to be very possible. And I think people will eagerly receive it. In the end, it is all going to depend on people's willingness, I think, to go along with some change. We're not really suggesting, I don't think any of us, that we're returning people to what has been normal in the past, at least not initially. And so everyone is going to have to embrace the idea that they're going to have to affect change in the way they interact with one another and the way they experience the college setting and the communities around the campuses. But I think if everyone does pull together in that way, behaves reasonably, and takes into account not only, as I said before, their welfare, but the welfare of others, then both the campus and the community that campus inhabits will be as safe as it can be.
Thank you, Damon. And just yesterday, you were speaking about how proud you were of our Penn State community because they have been doing that. They've been resilient to our change. Thank you about that. And while we're speaking of our students, can you tell us which students will be receiving federal assistance through the CARES Act? And can you explain what considerations went into that?
Yeah, Ben. Well, one of the themes I think we're hearing here is real concern from the institution about the welfare of individuals that constitute the university. And certainly when it comes to finances, we've been very concerned about employees, but we're equally concerned about students and their families. Fortunately, the CARES Act, which is a federal act, gave the university $55 million. That was based on a formula. The $55 million, as was the case with every university and college that received this kind of funding, half of it was directed by the federal government to go to students to address their financial needs that are arising out of the pandemic. So I think things such as course materials, technology, housing, healthcare, food, childcare, those were some of the expenses that were incurred by students as a result of the pandemic. The 27.5 million, the half of the 55 that had to go to students, is being allocated to 25,000 students initially through $1,000 grants each, cash grants. I think we have about 23,000 undergraduates and 2,000 graduate and professional students who are receiving those monies. The federal government's provisions stated very directly that students who are in completely online programs, so the World Campus student, would not be eligible for these funds. Also, students who were not eligible for federal financial aid were not going to be beneficiaries of these funds, which also excluded then international students and DACA students. The Department of Education advised us that the students most in need should be the primary recipients. And so we've decided that those 25,000 were identified through looking through federal financial aid forms and Pell eligibility. The lower income families are really the ones who are benefiting from these funds. All those students are receiving Penn State email notifications of their $1,000 grants. They get the option to accept or decline these monies. They have to affirm that these monies are being used for the eligible expenses that I mentioned before. They can then enroll through LionPath and the e-refund process that allows a direct deposit to their bank accounts. And anyone who doesn't do that and is accepting the grant will receive a paper check that's going to be mailed to the permanent address that we have on record. So that's $25 million, which leaves about $2 million, or $2.5 million in the sum that the federal government gave us for this purpose. That additional money will be allocated to students who have need but did not qualify through that initial phase. And so the Office of Financial Aid will be administering a process, a very simple process for applications for this money, and that's to go to students again at all locations. And I should say that we have had the benefit of a student emergency fund that has been increased significantly through this experience, through the generosity of others who have known that students are in need. The Student Emergency Fund is managed out of our Student Care and Advocacy Office, and those monies would be available for all students, including World Campus students, international students, DACA students, those who might not otherwise benefit from the federal dollars. But the sum of all this is really very helpful to our students' families, and we're very grateful both for the federal resources, but particularly for the generosity of private donors who've increased the resources available in the emergency fund.
Thank you, sir. And if you could tell them when those emails might be going out and when the deposits might start happening.
Well, they're going out as soon as possible, and the deposits would happen pretty quickly too. They have to go through that process though when they get the email. So students need to be paying attention to their Penn State email again, and they have to follow the instructions there. And then this e-refund process is not just automatic. You have to go into LionPath and make sure you have that process in place for the direct deposit. And if you want to receive the paper check and you want it to go to an address that isn't the one we have as your permanent address, you'd have to make that change too. But this is a process that's happening now. And so that and that second round, the $2 million I said for the second round of allocations through the application process, more information will be available about that very, very soon.
So just to reiterate, students, please keep an eye on your Penn State emails. That is the very beginning of this process. Provost Jones, if we could talk about the other portion of that CARES Act that was not going directly to students, can you tell us how the university is planning to use that?
Yes, Ben. I think Damon gave a pretty good description of the total CARES Act commitment to Penn State, and the remaining 27.5 million was designated to help the university keep our people employed to the greatest extent possible. And so, as Damon described for the students, we tried to be very careful to make sure that we were following all of the rules and all of the expectations of the federal government in committing these resources. And so that's exactly what we'll be using these dollars for. President Barron indicated a little bit earlier in the town hall about our institutional commitment to keep people fully paid through the end of April. And then in the May-June timeframe, that people who were not working would be paid at the 50% level. Of course, there are costs associated with making that commitment. And so this is what the focus of those funds are. There are many people across the university who are unable to work. It's not that they're choosing not to work, they're just unable to work because the workplace has been different. And so the federal government, through the CARES Act, has been a great partner for the university in providing resources for us to keep those individuals paid, albeit now at a slightly lower level. And so that's what we are using those resources for.
Thank you. Dr. Barron, we had a question come in and people are asking if there are any plans to adjust tuition for fall, similar to what was announced for this summer. Dr. Barron, if you could unmute your microphone. Again, the question was about any potential adjustments to the fall.
Thanks. So right before I answer that question, I also wanted to add to the masks, because we physical plant is been working to purchase 2,500 sanitizer stations, so that there's one at the entry of every building and at the entry of every classroom. So another step in that health and safety component that Matt was talking about. So the question is raised, I think, because we did discount tuition for the summer. And our feeling there was that one, we're in the midst of a very stressful environment, a lot of financial uncertainty, and it's really important to us to get people to the finish line, which is often what occurs at the end of spring semester and going into the summer, or not to hesitate, but to step forward and begin the process of getting your Penn State degree. So it was important to sort of reflect that financial insecurity to help people finish and get started. But in point of fact, we have the same faculty teaching our courses. We have the same outcomes regardless of where you're getting your Penn State credits from. And we have many students. The majority of our students take online classes to have flexibility, even though they're a residential student. So there's currently no plan to contemplate a change in tuition for the fall. Now, first of all, we're aiming to be residential. That's the objective. So that would be only natural. But even if there is some mixture of courses, this is par for the course for Penn State. A Penn State course is a Penn State course, all taught by faculty, Many students take online classes for their flexibility, and there's not a different price structure for them.
Thank you, sir. Provost Jones, Dr. Barron mentioned a mixture, and has the university considered a mixture or a hybrid approach to fall classes? For example, big lecture style courses could continue to be remote learning, while classes that require hands-on work, such as laboratories or performance classes, might be taught in person.
One of the things that really has been remarkable to observe, both formally through the task groups that we've set up and some of the sub-task groups, but also just across the entire university, is the innovation and creativity that faculty and staff are bringing to the challenges that we face in terms of delivering education in this rather difficult environment. So the short answer I can give you is yes. The type of delivery that you were describing is absolutely being considered, along with a whole host of other possibilities. And again, it's truly remarkable to see the collection of thoughts and ideas that are being put on the table. So I would say if everything is on the table, nothing is off. As we continue to monitor the situation on the ground, as our task groups advise us, we make decisions as an institution how exactly we're going to land in the fall. I think we're going to be superbly prepared by our faculty and staff to leverage all of these types of options and possibilities.
Thank you. Matt, we have a question for you, and it is born out of this previous question. When we do return to in-class teaching, that presents a challenging environment, as you, by its very nature, have more people in a room and many surfaces that people will be touching. So how does the university plan to protect faculty members and students in the classroom, for example, sanitizing the areas? Please.
So the public health is all about repeating consistent messages. So I'm going to come back to the same three things that I've come back to from the beginning, right? In the classroom, we're really focused on prevention. And the three key things here are distance, hygiene, and PPE, masks, right? So, what we're working on is trying to figure out what the appropriate balance is of each of those three things to allow us to achieve the operational goal of providing high quality instruction to our students while keeping everybody safe, right? So many of the things you've already heard discussed, phased return, provision of masks, putting sanitizer at the entry and exit point of buildings and classrooms, those are all really key elements to the prevention discussion. So everything that you've been hearing thus far is answering this question already. We're also, of course, looking at various different distancing options, very much tracking what are the examples that we're seeing out there for spreading events, for flare-ups of transmission in communities all around the world, to get a sense of what are the risky and not risky kinds of events. There are many places where people come together with masks and engage in relatively moderate activity that doesn't result in high levels of transmission. That's giving us a sense of what kinds of classroom activities might be safe and what kinds might we want to be cautious about. And so again, the sort of staged return to these sorts of activities, starting with those that we're sure are safe and easing into those that we're more concerned about, right, is part of the whole system that you're hearing expressed by everyone in this call. We're absolutely working with the folks, the facilities managers, and on cleaning schedules and trying to work out what the appropriate schedules for that are going to be. Really focusing on the high traffic areas, so the places lots of people will be coming through, and again continuing with the messaging both to the students and to the staff and to the faculty and everybody about some of the personal responsibility for hygiene as well.
Thank you. Dr. Barron, in your previous answer, you mentioned closing out someone's schooling here at Penn State with that summer session. Can you tell us, are there any plans for summer commencement yet?
Not yet. there could be a big difference between what the beginning of May is like and what August is like. So more to come on that topic.
Okay, thank you, Dr. Barron. We're going to stick with you for just a little bit longer as we are wrapping up. Can you tell us what efforts are being made to address enrollment and retention for the summer and fall?
Yeah, so there's a lot of different effort, you know, and it ranges really from a lot of different ways to think about this. One is just the quality of our programming and what is truly our flexibility to be able to meet students exactly where they are, whether that is in a remote environment or whether that's in a residential environment, whether it's on different campuses. We really are very capable of meeting students where they are and helping them get to the finish line. So this is part of our messaging in a lot of ways. The second is, and I like to say the front door of the university has completely changed. Used to be you walk on a Penn State campus and you would fall in love immediately. And if you got that far, the chances of you coming here just went up so much higher. Today, we've got a lot of our staff that are looking and participating in a very different front door. And that's a front door which is both personal and a digital environment where everything from orientation, spend a summer day, is welcoming and engaging, and a lot of follow through that is enabling that contact with students. We deferred for those that asked decisions, and now we're working hard to connect to them a whole group of sessions, 4 that we've invited them to participate in so that they can see what Penn State's all about, see our level of flexibility, see our level of care. And then finally, what is really you would call advertising, in which we have so many messaging out there about the degree to which we're flexible, meeting students where they are, helping them get to the finish line, and ensuring that that they know that they can have a lot of impact. Why wait? What are you going to wait for? What are you going to do while you're waiting? You might as well get that Penn State degree, because the other end is the highest number of big company CEOs, second in the nation, a network of alumni, you know, fifth in the nation in terms of where recruiters go for jobs. So we're focusing on those messages.
Thank you, Dr. Barron. And it's important to remember that that front door is just as open and Penn State is just as welcoming as ever. Would you share any, thank you. Would you share any final thoughts you have with the audience today?
Oh, I realize that you know, we've had a chance to chat here for a little bit. I'm so glad that we got to answer so many different questions that we know our employees are worried about, and I'm glad to have heard them and to be able to respond and really just to finish that remind people of what's guiding us, their health and safety, their financial security, and us living our mission and working hard to make sure that we have a robust Penn State and we support our community while we're at it. But I thank people for their attention.
And I'd like to thank Dr. Barron, Nick Jones, Damon Sims, Lorraine Goff, and Matt Ferrari for answering our questions today. And I want to thank the community for coming together during this unprecedented challenge facing us all. If we all continue to work together as we have been, you know, we can get through this as Penn Staters. And for faculty and staff members, please keep an eye on your email. Lorraine said that they're going to be coming some surveys to you. Students, keep an eye on your Penn State email, because there are valuable information coming to you there as well. I would also ask you to please bookmark and continue to visit psu.edu/virusinfo. It has the latest updates and information as we continue to battle this as Penn Staters. You'll find a link on this site, liveevents.psu.edu. Thank you all and have a good day.